Hey everyone, and welcome back. We're diving deep into a topic that's been getting a lot of attention lately, subcutaneous testosterone therapy, or sub-QT as you might have heard it called. We did a three-part video series on this a little while back, and this week we're going to be expanding on the second video in that series, focusing on the oh-so-important aspect of lab monitoring.
Yeah, it's really exciting to see more and more people becoming interested in this method. But with that growing interest, it's super important that folks, both patients and clinicians, feel confident in understanding how to make sure sub-QT is being used effectively and, most importantly, safely. And well, that's really what we're here to do today.
All right, so for someone who may be just starting to look into sub-QT, what are we even talking about here? Why is this method gaining so much traction?
Subcutaneous testosterone, or like we said, sub-QT, it's becoming a preferred method for TRT for a couple of key reasons. First off, it tends to provide a much steadier flow of testosterone into the bloodstream compared to other methods. That's a really big deal because it helps minimize those peaks and valleys in hormone levels that some people experience.
So it's more of a consistent stream, less of a roller coaster. Is that what you're saying?
Exactly. And what that means for the patient is often more stable moods, energy levels, even libido can be more consistent. Now, the other major advantage is that it's generally a lot more comfortable for patients compared to the traditional intramuscular injections. Those can be a little rough.
Yeah, I hear you. Nobody really enjoys a big needle.
Yeah.
So this deep dive, it's all about helping folks understand how to make sure sub-QT is working for them. But before we get into the nitty-gritty, let's talk about the groundwork, setting the stage for success. Where do we even begin?
It all starts with a comprehensive set of lab tests. And this is even before we even think about prescribing any testosterone, so this is pre-treatment lab work. Think of this like creating a detailed roadmap for each patient's journey. With sub-QT, everyone's different.
So this roadmap, it's going to show us what are we looking for in these initial labs?
First and foremost, we absolutely need to know what's going on with the patient's own testosterone production. We want to assess their current situation, right? And to do that, we look at three key players: total testosterone, free testosterone, and then we have sex hormone binding globulin, which you'll often see abbreviated as SHBG.
All right, so we've got these three tests. Let's break it down a bit for the listeners. Why do we need all three? Can't we just look at the total testosterone and call it a day?
But it'd be nice if it was that simple, but unfortunately it's not. Total testosterone, that tells us the overall amount of testosterone circulating in the blood. But it's like looking at a gift, it doesn't tell you what's inside. Free testosterone, that's the portion that isn't bound to proteins, and it's the one that's actually available to do its job in the body. It's the actual gift inside, ready to be used.
Makes sense. So then what about this SHBG? Where does that fit into the picture?
Ah, yes, SHBG. Think of that as the wrapping paper in the box around that gift. It's a protein that binds to testosterone and essentially acts as a gatekeeper, influencing how much of that total testosterone is actually free to act.
So even if someone has, let's say, a decent total testosterone level, but their SHBG is high, they might not have enough free testosterone to actually feel the effects, right?
You hit the nail on the head. It's like having a full tank of gas, but a clogged fuel line. You need both the fuel and the ability to get that fuel to the engine for things to run properly. Understanding the relationship between total T, free T, and SHBG, that's absolutely crucial for personalizing treatment effectively.
We're getting pretty deep into the weeds here, but it sounds like this level of detail is really important for getting those optimal results. So besides these testosterone markers, what other tests are we looking at in this initial workup pre-treatment?
Great question. We're also interested in seeing what's going on with the hormones that tell the testicles to produce testosterone in the first place. We got to figure out how the factory is operating. So we look at LH, which is luteinizing hormone, and FSH, which is follicle stimulating hormone. These are like the messengers sent from the brain to the testicles, telling them to get to work.
So we're basically eavesdropping on the conversation between the brain and the testicles, huh?
That's one way to put it. And what it tells us is whether the issue is with the testicles themselves, which is known as primary hypogonadism, or if the problem is with the signals coming from the brain, which is called secondary hypogonadism.
Oh, okay. Pinpointing the root cause, does that make a difference in how we approach treatment?
It can, absolutely. For example, if the testicles are fine, but they're just not getting the right signals, we might consider therapies that help boost those signals instead of directly replacing testosterone, like making sure that message gets delivered loud and clear.
Oh, so we've got our testosterone markers, we've got our brain-to-testicle communication check. Anything else we need to look at before giving someone the green light for sub-QT?
We want to make sure we have a good overall picture of their health, so we'll also typically do a complete blood count, or CBC, to check for things like anemia and red blood cell count, and a comprehensive metabolic panel, or CMP, which gives us a snapshot of liver and kidney function. We want to make sure everything else is running smoothly.
So it's a pretty thorough evaluation, really taking a holistic approach before we even think about starting SubQT.
Exactly. It's all about gathering the information we need to make the best, most informed, and safest decisions for each individual.
I know we've thrown a lot of information and probably some pretty intimidating medical jargon at everyone so far, but honestly, all this talk about labs and hormones, it can feel overwhelming, especially if you're new to all this. What would you say to someone who's feeling a bit intimidated by all these tests and numbers?
Oh, believe me, I get it. It can definitely feel like a lot to take in all at once. I think the most important thing to remember is that knowledge is power. The more you understand about your own body and how it works, the more confident you're going to feel about any decisions you make regarding your health. And we are here to guide you every step of the way, explain things in plain language so you never feel lost or confused.
That's reassuring. And it's great to know that you're not just throwing numbers at patients, but actually taking the time to explain what it all means.
Absolutely. We're all about empowering patients to be active participants in their health journey. It's a team effort, really.
Okay, so we've laid the groundwork. We've established this detailed baseline with our pre-treatment labs. But what happens next? Let's talk about the actual monitoring that happens once someone begins SubQT. What are we looking for? What are the key things we're paying attention to in those initial stages?
Now that's where things start to get really interesting. And that, my friend, is exactly what we're going to be diving into next.
I can't wait. This is going to be good. All right, so before the break, we were talking about how important those baseline labs are before
Yeah.
starting SubQT. It's like having a blueprint. But what about once therapy is actually underway? What happens then?
Oh yeah, that blueprint, it's absolutely essential. But just like with any construction project, you got to keep checking in and making sure things are moving along as planned. That's where the monitoring comes in. We want to make sure we're building something solid.
So walk me through it. We've got our blueprint. The patient started SubQT. What's next? How do we make sure things are on track?
We're going to keep a close eye on those key players we talked about earlier. Total testosterone, free testosterone, and SHBG. We want to see how they're responding to the therapy.
So it's not just a one-time check at the beginning. We're actually measuring these levels regularly throughout the course of treatment. Why is that so important? Couldn't we just assume things are working if the patient is feeling better?
It'd be great if it was that simple. But the truth is, symptoms alone don't always give us the full picture. Someone might feel a boost in energy initially, but their levels might still be a bit low. Or they might be experiencing some side effects without even realizing it's connected to their testosterone.
So we're aiming for that sweet spot, right? Good symptom relief, but without any unwanted side effects. Is that what you're saying?
That's exactly it. And those lab tests, they're like our compass. They're helping us fine-tune the treatment to really hit that perfect balance for each individual.
Okay, so you mentioned target levels before. Remind me again, what are we shooting for in terms of those testosterone numbers?
So typically we want that total testosterone level to fall within a specific range, usually somewhere between 400 and 700 nanograms per deciliter. But it's important to remember that's just a general guideline. What's optimal for one person might be a little different for someone else.
So it's not just about hitting a specific number. What other factors come into play when you're evaluating those lab results?
We got to consider how the person's feeling, of course. Are they experiencing any side effects? Are their symptoms improving? Their medical history is important too. Any other conditions they might have? And then, of course, there's SHBG. We got to make sure there's enough free testosterone actually getting to the body's tissues, even if that total testosterone number looks good on paper.
You're really hitting home that personalized approach, which makes a lot of sense. Everyone is different, right? Are there other lab tests we're keeping an eye on during monitoring besides those main testosterone markers?
Absolutely. Estradiol is another one we monitor pretty closely. And this is especially true as the dose of testosterone increases.
Now, that's estrogen, right? Why are we worried about estrogen levels in someone taking testosterone?
That's a great question. It might seem counterintuitive, but testosterone can actually convert to estrogen in the body. It's a process called aromatization. And if those levels get too high, that can lead to some not-so-fun side effects like gynecomastia, the development of breast tissue in men. Not exactly what we're going for.
Okay, so we're monitoring to make sure it stays in a healthy range and prevent those kinds of issues. Anything else on our radar? Any other potential problems we need to be aware of?
We also want to keep tabs on hematocrit and hemoglobin. Those are measures of red blood cell concentration. And testosterone therapy, sometimes it can cause those red blood cell counts to go up, which can thicken the blood. That can sometimes increase the risk of blood clots, so we got to watch out for that.
So too much of a good thing can be a problem. It's all about balance, like you said before.
You got it. And of course, we can't forget about prostate health. So we monitor PSA levels. That stands for prostate-specific antigen. It can be elevated in men with prostate problems, so that's always something we're keeping an eye on.
Makes sense. So you mentioned earlier that monitoring is not a one-and-done kind of thing.
Yeah.
How often are these lab tests typically done? Like, how often are we checking in with our patients?
That really depends on the individual and how they're responding to therapy. In those initial stages, we might check things a little more frequently, maybe every couple of months or so, just to make sure we're on the right track. But once things have stabilized, we can usually back off a bit, maybe once or twice a year.
Okay, so let's say you're looking at those lab results and things aren't quite where you want them to be. How do you approach making adjustments? What's the process like?
That's where the real art and science of medicine come together. We'll take a look at what the lab tests are telling us, but we also have to consider how the patient is actually feeling. What are their symptoms? Are they having any side effects? Are their symptoms improving or not? It's a conversation, really.
So it's not just a matter of, okay, the numbers are off, let's change the dose. There's more to it than that.
Absolutely. It's about taking everything into consideration, the whole picture. And of course, we want patients to feel comfortable speaking up, sharing their experiences, both good and bad. Based on all that information, we might decide to tweak the dosage, change the frequency of injections, or maybe explore some other options.
Let's talk about those adjustments a bit more. If a patient needs a dosage change, what does that look like? Do we make big changes or is it more of a gradual thing?
We usually take a gradual approach, step by step. We might adjust the dose by like 20 to 25% at a time, and then give it some time, like 6 to 8 weeks, for those changes to really take effect. Then we recheck those labs and see where we're at. No drastic overnight changes.
So no big leaps, more like fine-tuning the dial.
Exactly. It's like adjusting a musical instrument. You're trying to get that perfect sound. It takes a little patience, a little bit of trial and error, and of course, good communication between the patient and their healthcare provider. We're in this together, after all.
We are. So speaking of those early weeks after someone starts Sub-QT, what should they be paying attention to in terms of how they're feeling? Are there certain side effects they should be aware of? What are the red flags we want to watch out for?
Yeah, that's a good point. We always encourage people to be really mindful, especially in those first few weeks, and to let their doctor know right away if anything unusual or concerning comes up. Some common things we see are injection site reactions, some redness or soreness around the injection site. Those are usually pretty mild and easy to manage, but they can be a little uncomfortable at times.
You mentioned those before the break. Anything else besides those local reactions that we want to be on the lookout for?
We also want to rule out any signs of a true allergic reaction, although those are thankfully pretty rare. And then there are things like mood swings, changes in energy levels. Remember, when those testosterone levels start to change, it can take a bit for the body to adjust and find that new equilibrium.
It's not uncommon to feel a little off in those first few weeks, but it's important to keep that communication open with your doctor. Right? Let them know what you're experiencing.
Absolutely. That open communication is key. It really is the foundation for a successful journey with Sub-QT. We want people to feel comfortable telling us everything, the good, the bad, the in-between, so we can make those adjustments as we go.
Makes sense. So it sounds like there's a lot to consider in those first few months, getting things dialed in just right. But what about long term? Once someone's been on Sub-QT for a year or two, how does that monitoring change? What does that look like?
That's a great question, and one that we're going to delve into right after this quick break. Stay tuned.
And we're back, ready to wrap up our deep dive into Sub-QT monitoring. Before the break, we were talking about those first few months, getting things dialed in.
Yeah.
But like you said, this is often a long-term thing for people. So once someone's been on Sub-QT for a while, a year or two down the road, what does monitoring look like then? Does it change at all?
Yeah. The good news is, once someone's stable on their therapy, things have settled in nicely, monitoring doesn't have to be quite as intense. We can usually back off a bit.
Less frequent blood work. I bet that's a relief for most people. But we're still keeping a close eye on things, right? We're not just assuming everything's fine.
Oh, absolutely not. We're still going to be on the lookout for any red flags, making sure the therapy is still safe and effective. Typically, for stable patients, we'll transition to annual checkups.
Okay, annual checkups. And what do those look like? Are we still doing the same battery of lab tests?
We'll definitely still check those core markers, total testosterone, free testosterone, estradiol, SHBG, all that good stuff. But we'll also do a more comprehensive evaluation just to assess their overall health. So that might include a complete blood count, CBC, a comprehensive metabolic panel, CMP, to check liver and kidney function, a lipid panel to see how their cholesterol is doing. And of course, we're always going to be mindful of prostate health, so we'll continue monitoring PSA levels as well.
So it's really about taking a step back and looking at the bigger picture, making sure Sub-QT isn't having any negative effects on other aspects of their health.
Got it. It's about optimizing their overall well-being, not just focusing on those testosterone levels in isolation. And remember, this isn't a one-way street. We really want patients to be actively involved in their own care. It makes a huge difference.
What does that look like in practice? How can patients be more proactive when it comes to their Sub-QT journey?
First and foremost, open communication with their doctor is just so important. We want them to feel comfortable coming to us with any concerns they have, asking questions, telling us how they're feeling, all of it. And we also encourage patients to keep track of their symptoms, maybe jot down some notes and bring those to their appointments. It can really help us get a better sense of how things are going for them.
So it's more than just showing up for the blood test. It's about being an active participant in that conversation about their health.
Exactly. It's a partnership, a collaboration. And honestly, the more informed and engaged the patient is, the better the outcomes tend to be. It really does make a difference.
It makes sense.
Yeah.
So before we wrap things up here, is there anything else you'd like to emphasize about long-term monitoring or about Sub-QT in general? Any key takeaways you want to leave our listeners with?
Yeah, I think it's just important to reiterate that Sub-QT, it can be a really effective therapy for men with hypogonadism. But it's not a magic bullet. It does require that careful monitoring, open communication with your doctor, and just a willingness to really work together to get it right.
It's not a set it and forget it kind of thing, huh?
Nope, not at all. It's a journey, it's an ongoing process. The potential benefits are definitely there. Improved energy levels, mood, libido. It can even have positive effects on bone and muscle health. Ultimately, it's about helping men live fuller, healthier lives. And that's what it's all about.
I think that's a great note to end on. And for those listening who want to learn more about Sub-QT, be sure to check out that full 3-part video series on the Global RPH YouTube channel. We go into a lot more detail there, and we're always happy to answer any questions you might have in the comments section.
We'll also include links to some additional resources in the show notes for anyone who wants to do a little more digging.
So keep learning, keep asking questions, and keep those conversations going with your healthcare providers. Knowledge is power, after all.
That's right. Keep learning and keep thriving.